Hello, everyone, and thanks for joining us today. I'm joined by Dr. Sarah Zimmerman from St. Louis University. So, Sarah, thanks for being with us. And could you just tell us a little bit about your background and what your role is at, do we say SLU?
We can go with SLU. St. Louis University gets a little long, so let's go with SLU. Absolutely. Yeah, so
Yes, it does. All right, perfect.
thanks, Dennis. My name is Sarah Zimmerman. I am an assistant professor at St. Louis University, and I teach in their undergraduate occupational science and their graduate level um, occupational therapy program. My background is I had 20 years in practice as an pediatric occupational therapist, and I loved that. And then I started helping and assisting adjuncting with at the university, and I loved teaching the college students all of my knowledge. So I went back and I got my doctorate, and with my goal to be to teach at SLU, and I have been working there full time since the fall of 2019. So I started right right before COVID, and then really the majority of my teaching has been during COVID. And if you can start really teaching during COVID, you can kind of do anything, is what I've decided.
Absolutely. That was actually when I stopped my teaching, was during COVID. So, it's COVID has had apparently an effect on our
I,
culture. I don't know if you've heard this or not, but so can you tell us a little bit about you've had some background in simulation and just how that has gone, and maybe just a little bit about the context of SLU in terms of, is it in a large university, small university, just so if there are students or faculty that are listening, they can understand kind of what the context of SLU would be.
Absolutely. So SLU is a Jesuit university in St. Louis with a strong mission to be people for others. So we have a large healthcare program there. And so our OT program sits on the medical campus and in the Doisy College of Health Sciences. And so we align a lot with speech therapy, physical therapy, physician's assistant, all that type of thing, which adds for a lot of intercollaboration there. Our students take a lot of interprofessional education with our nursing students and our pre-med students and our PT and speech path in a collaborative manner. So that's kind of where it sits. It also makes it really easy to collaborate with, particularly in my program, we
Mhm.
collaborate with speech language pathology and physical therapy.
Gotcha. Great. And then in terms of that intercollaboration makes, in some ways, simulation a little bit easier, I think, in terms of either live simulation or video-based simulation. We're going to be talking today a lot about video simulation. So do you want to talk a little bit about like what types of simulation that you have at SLU and the opportunities that students have there?
Actually, absolutely. So we've always incorporated a lot of that hands-on simulation in with, live patients and with case studies and with various problem-based learning and all those types of things. And we had explored a little bit of kind of the virtual-based simulation, but as we know, COVID kind of turned everything upside down. And when COVID came on, we really were challenged with this situation with how do we teach critical thinking and problem solving and critical reasoning to our students when not only can they not be with live patients or not be in a clinic setting or not be together, but they're not even in a classroom with us, right? Everybody is, on their own bed learning these things. So how do we do that? So we really started looking at video simulation really as a necessity when COVID came down hard. How do we promote these skills for our students? Speech language pathology program at SLU had been using the virtual simulation for a long time and had really spoken really positive of it. But sometimes you need a really major change to force you to look at your best practices and look at what really works for students. And so that was kind of what COVID did for us. They had been using SimuCase, and so we decided to use that, give that a try within our program for our students.
Gotcha. And I think in the disclosure, occupationaltherapy.com and SimuCase are in the same family of companies. So we might be talking about SimuCase, but what we're talking about has relevance with all different types of video simulation. I'm old, and so I taught for a long time, and so I remember back in the days when you would go to YouTube and you would try to find something that was close to something that you wanted to have a student see, and you would find that link, and then you'd go back the next year. and the link wouldn't be there anymore. So I don't know, Sarah, if you had any experience with some of that, the hunting and pecking and trying to find, resources that were out there on YouTube or other platforms to try to figure out how to show some of this stuff.
I think it's only gotten worse with so many more people on social media and pushing out things. And you go to YouTube, you can find a million things, but they might all be terrible. There's so many terrible things out there. So some of the video simulation programs, you can kind of screen them and they find exactly what you want, right? I could find on YouTube a video of a child with autism, but with some of these video simulation, I can really find someone with autism who is having, a particular assessment completed on them or working on a particular skill. And so then we can incorporate that into our class. So it's actually been fantastic to have such a plethora of quality videos to choose from.
So could you explain to people that haven't really seen a video simulation what's entailed in it? Is there kind of a case study background that students read, or how do the students get introduced to it, and what is that experience both for the student side and then also for the faculty side?
Absolutely. So there's a multitude of different ways that you could use SimuCase. So I'll talk about how I specifically use it in my pediatric coursework. So part of how we use it is we use it as case studies that we do as a group in class. So for example, if I am teaching how do we work on activities of daily living with children, we can watch a clear video of a therapist working on, hair combing with a little girl with autism. And we can talk about all those interventions that we know of, such as, backward chaining and behavior management. And we can look at it, how the therapists use it, how she shapes behavior, how she promotes that occupation. And the students can do all the clinical reasoning with ourselves in a group within class. Then I can take it to the next step, and I can send them home and say, all right, you need to watch this case with this different student who's working on a different ADL, and you need to do the clinical reasoning on your own. So kind of scaffold that. That's one way we use it. They also have, there's also really nice simulations that the students can do on their own. So for example, if I have introduced the Peabody Motor Developmental Scales in class, and then we've gone to lab and we have worked in lab with the materials and done all the assessment, then they can go on and actually do the Peabody with a child, right? So they go on and it has all the background information. It has the occupational profile, what is the history of this child? What other services do they receive? Here are all the notes. And then they actually go on with the parent, which is amazing. And they have to pick out what questions would be appropriate to ask the parent. And it gives immediate feedback. If they pick the wrong question, that parent goes, I don't know why you're asking me that. Like immediate feedback. That question was not appropriate to ask, right? It is. It's great. And so then they have to go through that. And then they watch little clips of the child doing the Peabody. So the stacking of the blocks or the stringing, and then they actually have to score it. And it gives them immediate feedback of if they scored it right or not. And then after they score it, they have to interpret it. So it gives them that opportunity to take what they've learned in class and apply it in a very hands-on way with immediate feedback. And so it's great for the students to learn that. And then after they go through the whole process, then we debrief it. So we discuss what was easy, what was hard, how did you approach this task? It also gives me feedback as a professor if everybody is asking the incorrect questions to the parent. That gives me feedback. Well, obviously we need to talk about interviewing skills and what is appropriate and how do we develop an occupational profile in a more powerful way, since that's an area that was missing a lot. So, and that's just one example. There's so many different assessments to choose from or interventions to choose from across practice areas.
Gotcha. So I don't know how you were taught to do a Peabody, but I think I was sent home with a partial kit that was missing, half the pieces, and then, tried to find a nephew or a niece or someone that you kind of tried to do it with. And so, every student in the classroom had a very different experience, and that sounds like a little bit better way to really learn how to do an assessment.
It is. It's been mine. There's so many assessments in pediatrics, and there's so many variables in pediatrics. So it's been a really positive way for them to do it. And you can do it. Our students prior to this, they did it on their classmate who is trying to pretend to be a 4-year-old, but it's not the same. It's not the same as having this child that's like actively running away from the table while you're watching the video and seeing how the therapist redirects and when they move on and things like that.
Gotcha. Well, yeah, maybe I'd be a much better therapist now if I had exposure to that back when I was in school so many years ago. Um, so you've talked about SimuCase. How does that fit in with some of the other simulations that you use? So do you have like actors that you bring in, and you have case studies that you're doing with other types of disciplines? Is it kind of a developmental progression that you start with SimuCase, then you go to a live situation, or how to use it in your classroom or in the context of your larger curriculum at SLU?
So within our larger curriculum, we kind of have always done kind of a variety of things with, the live actors or things like that.
Hmm.
Also the, problem-based learning and the case studies, which is all great. I think the biggest thing with this virtual is they are actual patients, right? So this is an actual child who's 2 with autism going through it,
Hmm.
or, an adolescent working with AACUs. So these are actual people getting therapy, and that is hard to replace. It's hard to simulate.
Hmm.
We can have people act all day or things like that, but having the actual person and an actual therapist, and for them to see that, is really nice. Prior to
Hmm.
using video simulation, the only way that they could get that was when we had them out on level 1s and level 2 clinicals and out in the clinic space. And there's a lot of barriers to getting out into the clinical space, which we'll be talking
Hmm.
about. So this has really enhanced our students'
Sure.
abilities and really enhanced their skill level, right, and their confidence. Going back to the example of the Peabody, if they have
Hmm.
learned the Peabody in class and worked with the materials in lab and then done an assessment virtually, actively scoring the things and actively observing and pulling it together into a report, then when they go out onto a field work or in a clinic and do the Peabody, they feel a lot more confident. Or since in the clinical settings, we don't always have control over what they
Hmm.
actually get to do, I, as a therapist, know, all right, you've actually done that assessment,
Right.
even if you go out on clinical and you don't get that experience ever again.
Right. And we used to sell, back when I was an academic fieldwork coordinator, that everyone had different experiences and we brought those together and we learned from each other, which is true. But, then, the person that got to see, 6 assessments compared to the person that saw one 6 times, it was really a different experience for those level ones,
Exactly. The
particularly.
variation.
So you get a little bit more control over that as a faculty
Absolutely.
member.
And some kids are just really are they're unique cases, right? So for example, I might spend all my people might all go out on a 1 week level 1, but not see a student using an AAC device, right? So I can be sure to build that into the curriculum and have a medically
Hmm.
complex kid who uses an AAC device
Yeah.
and use that in the curriculum so that I know that they've seen that and had that experience and had to
Hmm.
critical think about that and problem solve.
Gotcha. But in terms of SimuCase, how many different pediatric cases would you say that they have?
They probably
I don't know if I'm stumping the band.
they break them down to 0 to 3 and then 3 to 21, and and they have, you can do part of assessments or you can do full assessments, and they probably, I would guess, about 15, and they're always coming out with new ones, which is really nice. Probably between 15 and 17 for me to choose from, and that's just for pediatrics. So on our community based class uses it. Community based field works, even though OT came from a mental health background, those mental health field works and community based field work experiences are hard to get, right? So there are some use cases, and that is used related to that area in our program also.
Yeah, I just had somebody reach out from Nebraska today looking for some level 1 mental health for one of the programs that I'm affiliated with. So it was the person that runs our email was like, what is this? What is this? And I was like, it's hard. So maybe I'll tell them a little bit about video simulation as well.
Absolutely, the video simulation can help fill that gap.
Yeah. And so certainly during COVID, but even before COVID, there was a major shortage in fieldwork sites. And I remember, I'm old, so maybe 10 or 15 years ago at an AOTA meeting, ACOT had come and wanted to get people's opinions about simulation, specifically looking at level 1s with the issue of the shortage, and especially in cities like St. Louis where there's multiple programs, or Philadelphia or New York that have lots and lots of OT programs that are friendly, but in some ways competing for level one and level two, and now capstone placement. So ACOTE now allows that. So does SLU use simulation as part of their level one fieldwork to count those hours?
So we do. So what was happening, like you talked about, like placement was getting tighter and tighter pre-COVID, and what it ended up, I feel like, following on is just the academic fieldwork coordinators were just like kind of told, like, figure it out, step it up, make more connections. But there's only so many connections to be made, right? And so COVID really kind of
Yep.
forced that change, and forced that, during the thick of COVID, we were having a hard time getting our level two students placed, and they really needed to be out there. So level ones
Sure.
essentially disappeared.
Right.
So how do we promote, using
Right.
how can we promote these critical thinking skills, and assessment and intervention and that problem solving that comes with it when they cannot go out? So that's kind of when we started, and we kind of thought,
Hmm.
oh, COVID. We kind of naively perhaps thought, oh, COVID came, and once we get, it was going to be it was going to be 2 weeks. And at the time, we thought, oh my gosh, 2 weeks. How are we going to be home together for 2 weeks? And how many years later?
Yeah. Wash the groceries when you bring them in the door.
Totally. Don't leave your house. It was a lot. Start your the good old days. So we were kind of thinking, like, okay, so once the vaccine rolls out, right, and once some of these restrictions lift, life will go back to normal. And that has not been our experience at SLU. There's kind of a second bump. So initially, people were taking limited level two students and no level one students because of COVID, right? But now, post COVID, Dennis, you had talked about the shift, how you had stopped teaching during COVID. I started. There's been a huge shift in the workplace and people's work environments, and a lot of the sites that we have traditionally used are like, we are sorry, we cannot
Hmm.
take any level one students because all of our therapists are brand new. Like, they are new to our hospital, they
Right.
are new to our pediatric clinic.
Hmm.
We can't put that on them right now. So we're kind of dealing with a different issue. And then at the
Right.
same time, sites are just getting so much more
Hmm.
competitive to get, with there being more programs and things like that. So we really had to look at creatively of how do we solve this problem, and not just say the academic fieldwork coordinator needs to figure it out. How can we actually make some meaningful change, not burn out that academic fieldwork coordinator, and do this in a meaningful way, right? We're not saying, like, oh, well, let's scrap level ones completely, or let's move all the level ones to a non-traditional site, which there's pros and cons to all
Hmm.
of those. But how do we really kind of promote the student learning in pediatrics, kind of, which also is my area, or within community based, kind of, in something that we can
Yeah.
control and facilitate?
Right. And really simulation has been used even for clinical hours in nursing for, oh, I won't say, for at least 10 years, probably even
Right.
longer than that. And for physicians, they use simulation and have used simulation in both of those professions. Really, um, we love our nursing and our physician friends, but they often have more access to
Hmm.
resources than for perhaps occupational therapy and occupational therapy assistant programs would have. So because of that, they've had a lot more years to really perfect that, and have really good evidence that shows that in some ways simulation is a better teaching and learning method, that students in some ways, because they're exposed to more specific skills, or are able to practice more specific skills, or, as you talked about, being able to implement specific assessments with feedback. And obviously, SimuCase and other um, products like SimuCase that provide that automatic feedback is very different, than simulation maybe that they were doing 20 years ago. So, older therapists like myself that might be a little, skeptical that they need to still learn those, psychosocial skills, and, to learn what it being an occupational therapist or an occupational therapy assistant entails. They're still going to have those experiences, but it's a nice way to be able to, in some ways, kind of control access to what the students are able to see and to be able to learn. So how do the students react to these experiences?
So, students, well, the research so far has actually been pretty good. That's starting to come out as far as in the,
Hmm.
OT is kind of new to using it, but as far as student satisfaction and perception, the research is looking pretty good. Duchesne has done some research and things like that with small studies. And we need continued research as we continue to use this more. Just per my students, students often too don't always know what they do or do not know. So it's kind of how you kind of sell it. They originally our OT students were like, "What? We're not going on clinical. What are you talking about? How are we going to learn?" But if you kind of or phrase it, well, you'll be able to do this if you went out on clinical. I don't know that you're going to have seen a Peabody,
Hmm.
but here you get to do it and work through it. So, and
Hmm.
even just
Yep.
that, we know that students learn through hands-on, right? Hands-on learning is the way to go. And
Hmm.
traditional lecture and lab, there there's a place for it, but we really need to engage them more, right? When you're sitting in a everybody's done a lecture and everybody's in that lecture hall, and that the students are looking at their phone and they're studying for their other test and they're online shopping. So how do we engage them? And that's with active learning
Hmm.
experiences, and that's what these simulations really provide, as an active learning
Right.
experience. And we've known hands-on experiences are great forever, but they take so much time to develop, right? If they're going out and collaborating and working in the
Right.
community, or you're bringing people in, they take so much time. And professors and people in academia, they are stretched thin. So how do we work smarter and not harder? And I do
Hmm.
really think that these virtual simulation programs, they make it
Right.
really easy to push in some hands-on learning opportunities and active engagement in the classroom for our
Hmm.
students, that in it without a huge time commitment on the part of the professor that's rolling it out. They've really done a lot of the background work to make it easy to use.
Right.
That's been a huge thing, because it doesn't matter how great something
Yeah.
is, if it makes it harder to work, it's not
Mhm.
it's not going to be sustainable. Not going to be sustainable.
Yeah, I remember there was a program I used to be affiliated with that had a really great neuro class that invited a lot of stroke survivors in one particular lab that they would do, and it was exceptional. And I think the students had great experiences, and the stroke survivors enjoyed coming in to tell their stories and to to go through assessments with them. But it was so much work. We were affiliated with um, a a lab that was doing ongoing stroke research and had access to 100 different stroke survivors, that if you wanted to have specific types of stroke folks come in, that you could do that. But that's not a situation that every program is going to have access to, and was a ton of work and didn't happen during COVID. So I know that they had to figure out their other options, just like you did during COVID, to really look and see what that was like. And I think the active learning is such a key component of it. I remember, because I'm old, um, when I was, we used to, there was this video that we watched at the university that I went to about how you should behave on a level one fieldwork. And it really was your, your, so it was a simulation of what a patient or what a student should be. So this was cutting edge back in the 50s when I was in school. So that, it was this video that we were supposed to watch that, kind of taught us how we should behave as a level one student, which was that you were a fly on the wall in the back of the room. And if anyone interacted with you, you were to redirect them back to the therapist. Like, it really was fully observational. And over the last 20 years, I think within the profession, we're trying to make level ones more and more hands on. But in some ways, simulation, like, you can't sit in the back of the room when the simulation is asking you questions, or when you have a parent that's yelling at you because you asked a dumb question. And so I think in some ways, skeptics can really see the opportunity that SimuCase or other programs like it offer. I don't know if you got yelled at on your level ones not to interfere with things. You're younger than I am, so maybe you weren't yelled at for those.
That's too funny that that was your level one experience, because now, so many programs require that you have so many observation hours already before you even apply to the program, right? So that's kind of more the observation. And if my students that are on their level ones now, if they don't get to like actively do something, they're a little bit bummed out. But it does depend on their personality and the age of their professor. Some of them will go on level ones and get, to be hands-on for every patient, and other people will go on hands on their level ones and be the fly on the wall, depending on the setting and what's going on. So then the simulation does really help equalize things, right? And what they have access to, and putting that brain to use.
And it's just sort of the nature, depending on what the curriculum is and what the level one experiences are supposed to be. That some may be in a situation with really sick, very acutely involved individuals that you don't necessarily want the student to be live and in person. And do you guys have any? Are there any NICU simulations yet, or no?
There's no NICU simulations, but that'll be huge when they have that.
Because every student I ever helped to place wanted to, not every, but many of them wanted to be in the NICU for their level 2 fieldwork. And my common line was, if you had a child in a NICU, do you want a level 2 student and week 3, doing intervention?
Everybody is obsessed with NICU.
Thought was typically
they still are really into the NICU.
Yeah, everybody likes the NICU.
So. And it's not entry-level practice either.
Yes. So if SimiCase is listening, it would be no, not even close. So if SimiCase is listening, maybe we could do a NICU one at some point, because it is important. But at major hospitals, they're not going to let a licensed therapist that's been practicing in the hospital for 3 or 4 years treat independently for some are 6 months before they can do anything. So anyway, we just have to help students understand that. So anyway, part of the fun.
Exactly. If there is a NICU one, I would use it.
There you go. So in terms of COVID, were you starting to use SimiCase before COVID, and then it just kind of exploded and really kind of forced your hand to use more of the simulation, or were you already kind of starting down that path within your curriculum?
It had been presented to us as something that we should explore by our speech language and communication science department, but there wasn't a lot of incentive to start it at the time, because we were just kind of status quo. So then COVID really forced our hand and said, you need to come try to do something different. Right. So, and then I've been at SLU for 3 years. Then when I came on and took over the curriculum, the pediatric curriculum needed some shaking up. You teach something a long time, people get into patterns of how they teach it and what they think is right. And I was ready to shake it up. And so I was a good person that was so excited about this opportunity to how do we get more hands-on incorporated into the every day, the every week, the every month, the regular curriculum. And so it was a perfect match for me coming in, because yes, we're going to use, I think the original idea was to use it, as a Band-Aid during COVID, but the benefits were so great that I saw that how could you use it and then take it away? So now we've adopted it as we do use it for fieldwork, but we also use it to supplement our course teachings.
Gotcha. So could you talk a little bit about how you used it? So was it a course redesign, or how would you term sort of your freshening up of the pediatric curriculum that you did?
Oh, yeah. Yes. So I can talk to two different things, Dennis. I guess I can talk about how did we use it explicitly as a level 1, and then how have I incorporated it into course design. So when we initially rolled it out, all learning and teaching and everything evolves. When we originally used it, our students were assigned to, I think, 4 different cases related to 4 different areas. A couple were pediatrics, a couple were community-based health, things like that. They were kind of given an orientation. This is how you do the program. And then they went and they worked through the different simulations on their own. And then they did a debriefing with them. And that debriefing piece is critical, right? Because we can send them out to do these things, but if you don't then discuss it and kind of problem solve and talk about strengths and weaknesses and where do we go next, it's not particularly helpful. And as they work through the simulation, not only you can get a grade for it. So you could use the case as, and they can always retake it. So if they're working through it and
as a quiz,
as a test, they can always work right back through it. So before they submit something for me, they need to have earned a 90% on it, or they need to go back and redo it. So that's how it was initially arranged. So they had 4 cases, they met and debriefed, for each case and got feedback. As my course design, I've really kind of worked to kind of scaffold it throughout the curriculum. So I spoke about when I teach ADLs, first we do it as a group and we look at the video and we talk about different interventions that we've seen and different strategies the therapists use and where do we go next. And then we kind of build along that. And so then maybe they'll learn about the assessment like the Peabody. Or there's so many different assessments that you can use. So I'll start with like an easy short, just a visual perceptual assessment because that one's really easy for them to work through and very limited in scope before I look at a more holistic, assessment that is looking at motor development and ADL development and sensory processing and, all of it. So I can able scaffold it. And then we'll build upon it. So, for example, if they have done their final project for my class is they have to do a full evaluation on CEUs, which is a case that looks at, ADLs and sensory and motor, and they have to go through the CEU of it. And then from the evaluation, they then have to develop a plan, an intervention plan, and develop out goals and interventions from it. So then we build on what we've used through the simulation and expand upon it. And it's been really, really positive. And I found that some professors in my program really like, cumulative tests and things like that. But I have found that the final project of them working through this full assessment and developing the intervention has really, really developed their skills in a really nice way and really promoted, critical thinking and things that are sometimes hard to develop in a multiple choice test and things like that.
Absolutely. So in terms of the simulations, are they learning sort of discrete skills as well? And I know, so transfers, those sorts of things are not quite as, I guess handling is more important in the pediatric courses that you're teaching, but are you able to assess those kinds of skills through simulation, or how does that fit into what you're doing in terms of just kind of those really kind of discrete physical skills that a therapist or an assistant needs to be able to demonstrate?
Yes, they're often asked those via questions during the simulation, if that makes sense, those discrete skills. So if they're looking at considering, safety of a child or, what type of grass was being used or what type of communication did the child use or what kind of behavior all those things are kind of asked throughout questions. So they'll watch the little video clip that might be 1 minute and then answer very specific questions related to that. And the questions are a variety of things from assessment to intervention to safety to things like that.
Nice. And then in terms of, like you said, that they're, if they're writing goals, if they're doing a note, do you get access to that? Do you grade it? Is there some artificial intelligence within CEUs that gives them feedback for that, or how does that work?
All of the above. So it'll give them, they'll sometimes have to, the simulation, what it will have is some of the questions will be multiple choice, and then some will be open-ended and then computer answered. So they might have to identify, write a goal, or they might have to develop, treatment things to focus on, and that's kind of all open-ended. And the program does all that for you. I can go back in and look at it, but the program will actually score all that and their competence at that. I then just choose to take it to the next level on their work outside the course and kind of building a more expanding upon what they've done on the CEUs.
Cool. That's like a dream come true for faculty, right?
That's why it's totally working.
Not that we don't love grading.
I tell my students all the time, I said, I love you. I love teaching you, and I hate grading your work. I know it's important, but it's so time consuming. But it is. It really is. I really feel like it's this working smarter, not harder.
That's all important. So my greatest contribution to teaching within occupational therapy, I spun it around and I made the students do lots of work, so I wouldn't have to do quite as much. But do you use portfolios at all as part of what you're doing with SLU? And the work that you're doing in terms of, back in the day, we used to have like, a sample of a good, Peabody score or the good write-up for our Peabody. But I also helped to teach an entry-level course that was, a lot of those discrete physical skills, like, taking a blood pressure and doing transfers and, manual muscle testing and all those sorts of things, and going through various scripts and pinches. And so that was a portfolio that students had to, do, I forget how many, maybe there were 60 different things that they had to videotape themselves doing, and they hated it. However, in terms of having to physically practice those skills really helped them to build that. And then, and I always, I had a random assignment of I would check like 3 of them for competency, and then the rest they was just on their own. So they hated it, but it worked really, really, really well. So the more work we can get students doing,
And they often hate the things that are very important for them to do, right? But yeah, so when you talk about grasp, so like on the simu case, it'll say like, oh, what type of grasp pattern did you observe? And so then they'll have to choose that out. So, but we do not have portfolios. We do not.
you can add this for next year. You can actually, they would have to go through and say which each one of them was, but they would have to demonstrate it. And it was just like, some were pretty fun with that in terms of, I remember one of them, one year it was always in the fall. And so they went to one of the hill days. And so they did like a video of, various grasps and pinches that they used during the hill day. So it was kind of fun. So I would let them do I would let them do groups, but they had to be like extra cool to get points, or otherwise graded them down pretty low. But this in particular, I remember one that was really cool. So just a nice way to spin that around, so that we have students doing more work, because that's what we're all about as faculty, is getting students to do more work. I'm kidding, but I always said the more I talked, the less students learned. So it really, we're an applied profession, and the more we can get students doing, the better off that's going to be, for everybody. So can you talk a little bit about how other faculty are using, simulation as part of their courses as well?
Since I was that kind of taking over academic fieldwork coordinator during COVID, the guinea pig, exactly. And also redesigning the pediatric class. I was like all in. So selling it to the other groups, but we really have expanded it. So our students are in the graduate program for 3 semesters. And so in the initial semester, they have it in a class called clinical conditions, right? And clinical conditions is exactly what it sounds like learning about different conditions and what you might do with that. And so kind of like you mentioned with the stroke, and she does bring in some guest speakers to speak, but that's hard to plan and things like that. So for each clinical condition, maybe not everyone, but she can say, oh, here is an example of a person who is living with, this diagnosis or that diagnosis. And not only, lived experience speakers are so powerful to use sometimes, but also they're time intensive also, right? You might not always have a whole day, a whole lecture to devote to one diagnosis or things like that. So it kind of enables her to use, video example and things like that, video simulation for that class. So they get it in that class, and then they get it in both of the pediatric courses in different intensities. And then our mental health class, our classes use it for looking at task analysis, because, we can task, and if we're talking about, activity analysis, occupational analysis, we can look at our friend, jumping rope or wrapping a present or doing whatever, but looking at a client doing that task is going to be much different. And what does that look like? And where does the problem occur? So it's used there. And then it's used in mental health and community-based practice. Community-based practice primarily because like we talked about, there's not a ton of sites always, and we can't always control the experience our students will have at those community-based sites. So how can we tie in some of those video-based simulations for different individuals with different mental diagnosis in community-based practice? So that we have multiple classes using it now.
Yeah, and in mental health settings especially, there was always, we had a spattering of students that would be able to be with an OT in a mental health setting. But as you said, many are in community-based settings for the level ones, without an OT there, or in a non-traditional setting, with limited OT there. And to be able to see an OT actually practicing in mental health, I think is a really, wonderful thing for them to see, because I always wondered that a lot of level ones, we love our rec therapy friends, but we provide different types of assessment and intervention than other professions do. And so, how do we really see what the role of occupational therapy is? And as you said, a part of our practice that's been there for a long, long time, and we just want to, continue and hopefully continue to expand that. Do you use it as I don't know if you have checkoffs, because I think that can be really useful because students are busy, and so they're in the midst of their pediatric coursework, and then they go to their mental health coursework, or then they go to their physical rehabilitation coursework, and maybe they've forgotten some of the things that they do. Can students go back and review SimuCase, maybe to prepare for level twos, or how else are you using that as part of your curriculum?
They have access to all of them. So if they want to go, so for example, and it will say kind of what the skill is working on. So if, for example, they're getting ready to go out on level twos and the therapist says, these are the different assessments we do, and they've never seen a TVPS or something like that. And oh, look, there's one on SimuCase. They can go on and look at it because they have access to all of those. And actually, because there are so many different ones to choose from, sometimes I won't have thought about, like, oh, for example, we have speech language come and talk about CEUs and things like that, but I never really considered, what if we use a SimuCase for that, until there was a virtual case there that we could use to kind of expand that knowledge. So students have access to all of them to kind of go through, and there's different ways you can use it. You don't always have to do it in test mode. You can do it in learning mode. You can just do it in video. So there's different ways that you can use it within the various programs.
Gotcha. Is there like a checkoff before they go to level two fieldwork, or that's kind of up to the individual student? We we had two checkoffs. They had a multiple choice test that they did that was ridiculously involved, but then there was also physical checkoffs that they had to go through and just kind of rewind some of the physical skills that they learned as part of the program. And I don't know if you do that, or if that's something that different programs might be able to use SimuCase for as sort of a refresher for them before they leave.
You know what? That's not actually something our program does, but might be something worth considering, because they have checkoffs, over the course of the course, as far as transfers or whatever it may be. But it's not right before going out on level twos, and it hasn't been an issue really, because our students have been pretty successful on level twos. But something to consider to refresh for them, just to kind of increase that confidence, just because there is a lot of anxiety and uncertainty before they head out on that level two. But I haven't used it that way, but that would actually be an interesting way.
Yeah, and even like it's just a nice thing to. I don't know if they're showing their level two fieldwork educators what SimuCase is, to be able to see some of the learning. That was one of the parts of the portfolio that was useful. Was a student that said we never learned a sliding board transfer or whatever it was. You could literally pull up the video of them doing a sliding board transfer. Not that it was used in a punitive way, but just sometimes students all of our curriculum are just so jam-packed with lots of information, and it seems like we're adding more parts of to our curriculum each year, and we're not taking anything away. So just those are things that, and as you said, that the access that the student has to SimuCase kind of across their time as a student is really great. Now, so how does your program handle funding SimuCase? Is that something that students are required to pay for, just as they would be required to use a textbook for, those sorts of things?
That's exactly it. It's tied into their kind of curricular costs, like like a textbook would be, or things like that. So they kind of pay. So the student kind of pays for that piece. Exactly. So actually, the more it benefits them, the more courses that utilize it, because then they get more out of their spending. But you were speaking about, I had a bunch of I'll say new graduates, because they graduated maybe 5 or 6 years ago, that were coming back and were helping with something at SLU. And I was talking about the pediatric class, and I was showing them the virtual simulation that we're using, and they were like blown away. They were like, these students have no idea how lucky they are to have this. And once the students have it, they're kind of like, whatever, like it's fine. But the students that had graduated before that did not have access to this virtual simulation were really jealous and really excited for how they felt the students would be much better prepped going out into the world and things like that, because of the virtual simulation class, experiences that they've been able to have.
Yeah, absolutely. I wish, as I said, I wish I had access to it, for sure. Now, are you also using this with other, like, are you using it with, the speech or PTs or other professions within your within SLU to do some interprofessional collaboration? And does SimuCase have specific interprofessional collaboration opportunities within their cases?
So we're just starting to look at that. And the reason is, so our students take this interprofessional education course actually, and it's, a case study, and there's, medicine and nursing and, PT and OT and all these disciplines on it. And our students always, and it sounds in theory like a great class, right? And our students always give us a ton of feedback, like that the medical students just take it over and that they still don't know what OT is, and that the cases aren't very, applicable to OT and things like that. And we're like, okay, same class. They say it every year.
Hmm.
But what we're really looking at doing is expanding, really looking at using the simulation, because some of the simulations have multiple disciplines on them. So for example, we had a speaker from the speech language program, and she was in and she was like, oh, I'm going to show you a video of this person, Gabriel, who uses an AAC. I'm like, oh, this is great, because they're actually going to do that case in 2 weeks. And so then they can see this, what speech is doing, what OT is doing, or what PT is doing, what OT is doing.
Hmm.
The next step, and I'm looking at working with this with our
Hmm.
the person in charge of PT and the pediatrics, is what does it look like if we actually do the case collaboratively? So have the students do it and then debrief it in a
Hmm.
collaborative way. So that's kind of how we're looking at taking it the next step forward, because it's one thing, to do the virtual and see what the speech does and see what the OT is. It's another thing then to debrief it together and really talk about that, especially in OT, because our students, and
Hmm.
you probably found this too, sometimes they struggle in knowing, they want their lane, right? This is where I stay and this is what I work at. And if I'm working with feeding, what is me and what is speech? And if I'm
Yeah.
working, on with a kid with cerebral palsy, what
Hmm.
is PT and what is me? Because we mesh into a lot of different areas. So
Hmm.
helping them kind of brainstorm, really, it just comes from
Right.
how you see the child is different, and that has value. You view that child differently if you're a PT or an OT or a speech path,
Hmm.
just because of how the theories and things you've been taught. So I think that debriefing will help them better understand that piece.
Yeah, and it was, and so there's great opportunities in interprofessional collaboration. And I think OTPT speech, we get each other, we know what each other does. But you're right, when you get into the other professions, there was one I was in with dentistry on a regular basis, and like every case study, there was like an impacted mouth
Exactly.
or something like that.
Exactly.
It was like, you know, okay, so now I know if someone has a feeding issue, I guess I should maybe refer them to a dentist. But you're right, like to be able to see us all on equal footing can be a little bit challenging. And I don't know if SimuCase is in the medical side of things, but it's a nice way to when you build those together, because it always seemed like there were things that were cobbled together to keep OTPT and speech happy with the other professions, for sure.
Absolutely. The IPE, I feel like there might be a little bit of, hierarchy of what's the most important, and the therapies tend to feel that they're at the bottom of that, which is not true.
Yes, it's all about quality of life, I think, in terms of what we're trying to support people to
Absolutely.
do. Um, so do you feel like your students, or have your students felt, I guess the feedback from the graduates is that your students should be better prepared for their level twos, but are you getting some of that feedback? I don't know how long you've been using the SimuCase as part of, if you started in 2019. So are you starting to see now some feedback from your students on their level twos? You said they were always doing well, but maybe the fieldwork educators feel they're a little better prepared or not, in terms of having access to these cases.
The fieldwork educators have felt like they've been better prepared in most recent years, and the students do. I think a lot of it is that confidence, that they just feel a little bit more confident because they've actually, worked a student through this assessment or through this intervention, or, or they've seen multiple students, working on this through the clinical simulation. And so I think that increased confidence, maybe, not when they're walking through the door to the clinic, but once they're in the clinic and they're like, oh yeah, I've seen this, I am comfortable with this. So that increased confidence, and the feedback from our level one and level twos has been more positive in the past few years, which has been great.
Nice. Well, and I would think too that even like it's a value added, but perhaps for, for a large school district or a hospital that you're working with that, is doing a lot of Peabodies. And, OTs are our own little interesting breed sometimes to be able to have a group go through a Peabody of experienced clinicians to go through and say that, so this is what the Peabody says the score is. Is this what the score is that you're actually giving them? And it's in the book and all that sort of stuff. But sometimes it's nice to get that, the to get everybody, all the raters on the same page to be able to do that. I don't know if that's something that you're able to offer, and I don't know what the licensure is for SimuCase and that sort of stuff, but to be able to show a group of practicing therapists how to review an assessment in that way.
Oh, we haven't used it in that way, but it's something to kind of consider, like how they use that. So
Because it might be something, just to, as you think about like, and is the COPM on
the
SimuCase?
COPM is on SimuCase. I have not used it, but it is on there.
Gotcha. So that would be a really interesting thing. I know at Cincinnati Children's, I think they do the COPM with everyone that they evaluate. So it'd be kind of interesting because for me anyway, the COPM has a little bit more variability. I'm sure our Canadian friends, if anyone's listening, I'm sorry I said that. But it might be interesting to see, how is, because they're using that data kind of collectively. So I might take that back home to my OT friends at Cincinnati Children's to give them that idea to look and see how they're using that. Anything else you'd like to share about kind of your experience with simulation or anything that surprised you or things maybe that you'd like to see in the future for clinical simulation?
So I guess I was prior to COVID and using it. I wasn't super interested in like the benefits of it or things like that. I thought, you have to be in person in order to develop these skills. And I will say that using it and really seeing the students change in how they interact with how they my ability to kind of control their experience and provide them with more meaningful experiences and how that enhances their clinical thinking has been really powerful. And so I will never go back to not using it. I'll use it in all my classes to provide more, active engagement and active learning as experiences. And I love that they're always adding new things. So like, different niches that I haven't used before. And so I love that piece of it. So I would really encourage anybody, and again, that piece that it's so easy to use and so easy to incorporate into what you're actively already teaching and trying to support. So I would support anybody in exploring it and using it across disciplines, across classes within their curriculum, because it really is really powerful.
Yeah, how was the onboarding for you to get used to learn SimuCase? Was there kind of video support to be able to do that, or how did you kind of get up and started? Or was it?
There was a lot of support. It takes one, we had one person at that time that was really in charge of really all the onboarding for it, and she really laid it out for us very well. But she had a lot of support from the organization. And since then, once you kind of, and like anything, the more you use it, the better, the faster you get, and the better and more comfortable you got with it. But that onboarding is not hard. And then, kind of like anything, when you develop out of class, the first time you develop it, it's so much work, and the second time a little, you learn and kind of tweak it. And now it's kind of very easy to kind of take and drop into different courses and things like that.
Well, good. So if SimuCase is listening, we've already talked about the NICU. Any other types of scenarios that you'd like to see them do?
I would love to see a cerebral palsy in a young child, because you can talk about tone, and it's hard to get kiddos in because it's during the school day and things. You can talk about tone and how it impacts movement, but to really see it is really challenging. And I have not found anywhere via SimuCase or via
YouTube.
anywhere on the internet, and I've tried nothing on YouTube, nothing. And I found one, and or if it's on YouTube, it's not OT, it's like PT. So that CP with a younger child, that would be my recommendation.
All right. Well, if SimuCase is listening, maybe that'll be coming out here in the next year or so. So I'm not sure how long it takes them to develop stuff, but there you go. We're putting the call out. So. Well, Dr. Sarah Zimmerman from SLU, thank you so much for sharing your experience with clinical simulation with us. It was a very interesting conversation.
Absolutely. Thanks for having me, Dennis. I appreciate it.
Have a great day.